Peter, thanks for joining us again. In Victoria, while we've had another shocking death toll today, the highest of the pandemic, it's the second day in a row with infections down into the 300s. Dare we suggest that there could be evidence of a flattening of the infection curve now in Victoria?
Well, I think there does look like there's a flattening of the curve. I'd prefer to see a turning of the curve, but you've got to be a bit careful with numbers. Even though 100 sounds quite different from the day before, it's really a 5-day moving average that's more important, is what it's doing. And that appears to be at least flat. And hopefully in about 5 to 10 days' time, we'll see that it goes down to numbers like no more than 100 a day or 50, because that will mean, hey, this is getting under control. And the deaths will still be up for a while, because for every 100 cases, roughly you get about one death, but the deaths lag 2 to 3 weeks behind your case numbers. So unfortunately, we're going to see high levels of deaths per day for probably another week or two before they start coming down as well.
Given that we've seen the curfew in Melbourne in place now for just a week and the stage 4 lockdown really for 5 days, is it too early to have seen any impact from those measures?
Well, you'd expect the stage 3 lockdown should have had an effect evident by about a week after, and definitely by 10 days to 14 days. But you've got to remember, a lot of this infection is occurring within essential health care workers, their homes, or even their workplaces. So what's really important on top of the lockdowns, but more importantly, is to make sure people decrease the chance of getting it themselves and giving it to others. And that includes their workmates, their friends and their family. So all those basic things about physical distancing, washing your hands, keeping away from anybody that's sick, including in your own home, is very important to follow, not only before, but even now as well.
Now, if we look to Europe, there's been a lot of focus in recent days about declining mortality rates in Sweden and in the UK. Is there any room for encouragement there? Is it too soon to be talking about herd immunity in places like that?
Well, I think it's too soon, because even if you look at the mortality in those places, they're still higher than Australia. And Australia, we had a mortality rate of about 1.4% during the first wave. But the reason for that is that we weren't overwhelmed and we did a lot of testing, and we don't think we missed too many cases, 20% maybe at the most. So our mortality rate looked, low, because our denominator, or the number we were dividing it with, we were catching most people. In places like England, America, they were overwhelmed. Anybody with mild disease didn't get a test, so that their mortality rate looked higher. Now that they're doing more testing, they're actually looking like they're getting a lower mortality rate, but you still got to remember it's still higher than Australia.
Yeah, that's important context there. I want to talk to you about possible treatments. We spoke to Professor Thomas Borody last week, who's advocating strongly for the use of ivermectin along with an antibiotic and with zinc, saying that three-pronged approach, he says, is very effective. And as you know, there have been test tube trials, in vitro trials, that show ivermectin can kill the coronavirus. How encouraged should we be about this drug, and how quickly could the appropriate clinical trials allow for widespread usage?
Well, I think there's a lot of things that can look good in a test tube, but they're either too toxic or else they don't work in real life. And you might remember hydroxychloroquine looked terrific in a test tube too, but in real life it seems to have been of marginal benefit, if any. So look, anything that's promising, we need to do trials. There's a lot of people that are inability to do trials. Perversely, it's a bit harder to do it in Australia up to now because we haven't had enough cases. But in the UK in particular, they're doing a lot of good trials in large numbers of people, and it can be done in the US as well. But I put this in the same category as hydroxychloroquine. Yes, it looks like in the laboratory it might have some benefit, but until we do the proper clinical trials, I wouldn't adopt it widely. Admittedly, it's a moderately safe drug, but you don't want to adopt it as gospel without the proper trials being done and set up.
Now, obviously, there's a lot of work on vaccines as well and on these treatments. In your judgment, what are we likely to get the best benefit from earliest? Is there a chance that we'll find some quite effective treatments before we get to the stage of having an effective vaccine?
Well, I think we need to pursue both. I mean, nothing so far, I might say, looks fantastic on the therapy point of view, but people are working on it. They're looking at drugs or compounds that work on different receptors or different parts of the virus. So yes, in some ways that can be quicker if you come up with the right compound, but so far I unfortunately haven't seen that. for vaccines, the problem with vaccines is that we really need something 90% effective if we want to get elimination. Because if you look at infections that we have been good at getting elimination, measles, German measles that are respiratory viruses, we've had a vaccine that's 90% effective. If we have a vaccine that's maybe only as good as the influenza vaccine, 30 to 50% effective, you don't get elimination with that. You still have to keep on doing all the things that we need to do now. But unfortunately, I think that's the situation for the next 18 months or even 2 years. Even if the trials in the UK and England and Brazil show, hey, this is a terrific vaccine that works and has got great efficacy, you then have to produce it and distribute it and everything else. And so realistically, that's at least a year away and probably not for the end of next year.
Sobering thoughts indeed. Professor Peter Collignon, thanks for joining us again.
Thank you.